Have you ever felt that dizzy sensation when getting out of bed in the morning? Or perhaps when standing up quickly after sitting for a long time? This feeling of vertigo, which often catches us by surprise, is a sign that something in your body isn't working as it should. Dizziness upon standing is not a rare phenomenon, and in fact, it can be an important warning sign about your health. But what exactly happens in our body when we feel this dizziness? The main reason behind this symptom is the difficulty your body has in quickly regulating blood pressure when changing position, especially when you get up from a lying or sitting position. When you stand up quickly, gravity causes blood to pool in the extremities, and your body needs to adjust blood circulation to ensure the brain receives the necessary amount of oxygen. Under normal conditions, the body adapts to this change of position quickly and efficiently. However, in some people, this process may be slower or ineffective, resulting in a temporary drop in blood pressure. When this happens, you may feel dizzy or even faint. This phenomenon is known as postural hypotension or low blood pressure upon standing. The feeling of dizziness is, therefore, your body's response to the difficulty in adjusting blood pressure. Although this feeling of dizziness may seem simple and fleeting, it can indicate a larger problem, such as dehydration, lack of nutrients, or even more serious conditions like heart problems or nervous system disorders. Therefore, do not ignore these signs. Dizziness upon standing should be observed and understood, as it can be an important warning sign about your overall health. Fortunately, most people can control or prevent dizziness upon standing with some simple lifestyle adjustments, such as adequate hydration, a balanced diet, and avoiding standing up quickly. But in more serious cases, it is important to seek medical help to investigate the underlying cause. Postural hypotension, or low blood pressure upon standing, is one of the most common causes of dizziness. When you stand up quickly from a lying or sitting position, gravity causes blood to pool in the extremities of the body. This temporarily reduces blood flow to the brain, causing a feeling of dizziness or even fainting. This process is usually quick, but in some people, it can be more pronounced and take longer to stabilize. In a healthy person, the nervous system automatically controls blood pressure and blood flow, ensuring that the brain receives enough oxygen, even during changes in position. However, when a person suffers from postural hypotension, this adjustment does not occur as quickly. As a result, the brain does not receive enough oxygen for a brief period, which causes dizziness. Postural hypotension is more common in the elderly. As with aging, blood vessels lose some of their elasticity, making it difficult for blood pressure to adjust quickly. This makes older people more susceptible to dizziness when standing up, especially when they're dehydrated or taking medications that affect blood pressure. In addition, certain medications can also contribute to postural hypotension. Diuretics, blood pressure medications, antidepressants, and heart medications can lower blood pressure, making it harder for the body to quickly regulate blood flow when standing up. People taking these medications should be aware that they may be more prone to dizziness, especially when standing up quickly. To prevent dizziness caused by postural hypotension, it's important to take some simple precautions. For example, get up slowly from bed or a chair. When standing, try sitting on the edge of the bed for a few seconds before standing up completely. This gives your body time to adjust blood pressure and prevent feeling dizzy. In addition, staying hydrated is crucial. Dehydration can worsen postural hypotension, so drink plenty of water throughout the day. Regular exercise also helps improve circulation and the flexibility of blood vessels, reducing the risk of dizziness when standing. If you experience frequent dizziness when standing, it's important to consult a doctor. Early diagnosis can help identify whether the cause is just postural hypotension or if there's another underlying problem that needs to be treated. Your doctor may recommend medication adjustments, lifestyle changes, or, in more severe cases, additional tests to investigate the cause. Dehydration is one of the most common, yet often overlooked, causes of dizziness upon standing. When the body lacks fluids without sufficient fluid intake, the body cannot maintain adequate blood volume, which affects blood pressure and circulation. Water is essential for the efficient functioning of the heart circulatory system, and virtually all vital functions of our body. When you're dehydrated, blood volume decreases, meaning less oxygen is being transported to the organs and muscles. This makes it harder for the body to regulate blood pressure, especially when you change position quickly. With less fluid circulating, the brain and other vital organs may not receive the necessary amount of oxygen, resulting in dizziness. Dehydration also affects the body's balance. This is because water is responsible for maintaining the balance between electrolytes and fluids in the body. When you are dehydrated, the balance between sodium and potassium decreases, which can interfere with muscle and nerve function, resulting in dizziness. One of the simplest and most effective ways to avoid dizziness caused by dehydration is to ensure you are drinking enough water every day. The recommended daily intake for most people is about 2 to 3 liters of water, but this can vary depending on physical activity, climate, and health conditions. If you're exposed to excessive heat or engaging in intense exercise, you should drink even more. A helpful tip is to drink water throughout the day instead of consuming large amounts at once. This helps keep the body constantly hydrated and prevents overloading the kidneys. It's also important to watch for signs of dehydration, such as dry mouth, dark urine, fatigue, and, of course, dizziness. If you notice these signs, it's time to increase your fluid intake. In addition to water, other foods rich in fluids can also help maintain hydration, such as fresh fruits and vegetables. Watermelon, cucumber, oranges, and strawberries are examples of foods that not only hydrate, but also provide essential vitamins and minerals for the body. If you continue to feel dizzy frequently, even after hydrating properly, it's important to see a doctor. Dehydration can be more severe than it seems and may be a symptom of other health conditions, such as diabetes or kidney problems. A doctor can help identify the cause and provide appropriate treatment. Did you know that problems in the vestibular system, responsible for balance, can be one of the causes of dizziness when standing up? The vestibular system is composed of structures in the inner ear that help maintain balance and spatial perception. When these structures are affected, dizziness can occur, especially when changing position quickly. Inside your inner ear, there are small semicircular canals that detect rotational movements of the head and help send signals to the brain to adjust your balance. When these canals become damaged or inflamed, what is known as vestibular dizziness can occur. One of the most common conditions affecting the vestibular system is labyrinthitis, an inflammation of the inner ear that causes vertigo. Labyrinthitis is usually caused by viral or bacterial infections and may be accompanied by symptoms such as loss of balance, a spinning sensation, and even nausea. If dizziness is intense and lasts more than a few minutes, it may be related to vestibular problems such as labyrinthitis or other inner ear conditions, such as Meniere's disease. Other conditions that can affect the vestibular system include benign paroxysmal positional vertigo, BPPV, which occurs when small calcium crystals break off and move into the semicircular canals of the inner ear, causing episodes of sudden dizziness. BPPV can be triggered by rapid changes in position, such as getting out of bed. If you're experiencing dizziness upon standing, along with symptoms such as loss of balance, ringing in the ears, or a spinning sensation, it is essential to see an otolaryngologist, ENT specialist. The doctor can perform specific tests to assess the function of the vestibular system and determine if the cause of the dizziness is related to the inner ear. Fortunately, there are treatments for vestibular problems. Vestibular rehabilitation, which involves specific exercises to improve balance, can be very effective in relieving dizziness symptoms and improving stability. These exercises help train the brain to compensate for the loss of inner ear function and reduce the sensation of vertigo. In addition to vestibular rehabilitation, medications can be used to alleviate vertigo symptoms, such as antihistamines and anti-nausea medications. However, the key to treating these problems is to seek professional help as soon as possible to prevent dizziness from becoming a chronic problem. Did you know that certain medications can contribute to dizziness, especially when standing up? Many common medications used to treat conditions like high blood pressure, depression, or heart problems can have side effects that affect balance and blood pressure. These effects may be more noticeable when you stand up quickly, resulting in dizziness or a feeling of faintness. Medications such as diuretics, beta blockers, and antidepressants, for example, can lower blood pressure, making it harder for the body to adjust blood flow when standing. When blood pressure drops suddenly, the brain doesn't receive enough oxygen, resulting in dizziness. If you take medications to control blood pressure, you may be more susceptible to postural hypotension, especially if the medication is combined with others that also affect blood pressure. Medications like diuretics, used to treat fluid retention, can also cause you to urinate more, resulting in fluid loss and consequently dehydration, which worsens dizziness. If you're taking medications that may cause dizziness, it is crucial to talk to your doctor. They can adjust dosages, suggest alternatives, or prescribe additional medications to help manage side effects. Furthermore, if you're taking more than one medication, the risk of adverse interactions increases, which can contribute to dizziness. It is important that you never adjust or discontinue medication on your own. Always follow your doctor's instructions and report any new symptoms that arise, such as dizziness or weakness. Your doctor can monitor your symptoms and find the best solution to ensure you are treating the underlying condition without causing unwanted side effects. In addition to medical treatment, healthy habits such as staying hydrated, exercising, and following a balanced diet are also essential to help reduce dizziness and improve your overall health. The combination of medical care with a healthy lifestyle can be effective in preventing dizziness and ensuring well-being. Now that we have explored the causes of dizziness upon standing, let's focus on how you can prevent this symptom and improve your health. The good news is that in most cases, small lifestyle changes can help control and even prevent dizziness upon standing. The first important tip is to stand up slowly. When waking up, avoid standing up abruptly. Instead, sit on the edge of the bed for a few seconds before standing up completely. This gives your body time to adjust blood pressure and prevent dizziness. Avoiding sudden movements is a simple but effective way to prevent dizziness. Proper hydration is another essential factor. Dehydration is one of the most common causes of dizziness, so drink water when you wake up. Staying hydrated throughout the day helps regulate blood pressure and ensures your body functions efficiently. Aim to drink at least 2 to 3 liters of water per day, depending on your needs. In addition, a balanced diet is fundamental. Nutrient-rich foods, such as fruits, vegetables, and whole grains, help maintain stable blood pressure. Nutrients like potassium, found in bananas, potatoes, and spinach, are particularly beneficial as they help balance sodium levels in the body and improve cardiovascular function. Regular physical exercise is also one of the best ways to avoid dizziness. Exercise helps improve blood circulation and the flexibility of blood vessels, which facilitates blood pressure regulation. Try incorporating activities like walking, light jogging, or yoga into your daily routine. Low-impact exercises are also effective for maintaining balance and reducing episodes of dizziness. Reducing stress is equally important. Stress can increase blood pressure and affect your cardiovascular health. Practicing relaxation techniques, such as meditation or deep breathing, can help reduce stress levels and improve your overall well-being. Dedicating a few minutes of your day to slowing down and relaxing can have a positive impact on preventing dizziness. If you have a history of high blood pressure or other cardiovascular health problems, it is crucial to monitor your blood pressure regularly. If you're already taking medication to control your blood pressure, talk to your doctor about any adjustments that may be necessary to prevent dizziness. Constant monitoring is key to preventing serious complications. Therefore, the simple changes you make every day can help prevent dizziness when standing. Getting up slowly, staying hydrated, exercising regularly, and reducing stress are effective ways to improve the health of your cardiovascular system and ensure you have a better day stable and without dizziness. Although dizziness upon standing is often harmless and related to factors such as rapid changes in position or dehydration, there are situations where it could be a sign of a more serious problem. If you are experiencing frequent dizziness or if it is accompanied by other symptoms such as chest pain, shortness of breath, weakness, or fainting, it is essential to see a doctor. If dizziness upon standing is intense and lasts more than a few minutes, or if it is accompanied by a feeling of faintness. This may indicate that something is affecting your cardiovascular system. Conditions such as arrhythmias, heart disease, or nervous system disorders can cause severe dizziness and need to be investigated by a professional. Additionally, if you have a history of heart disease, diabetes, or high blood pressure, dizziness may be a sign that something is not working correctly. A doctor can perform a series of tests, such as measuring blood pressure, cardiac function tests, and other specialized examinations to determine if there is something more serious behind this symptom. Blood tests, an electrocardiogram, ECG, or even an echocardiogram can be performed to monitor heart function and identify possible arrhythmias or heart valve problems. If dizziness is the result of a condition such as postural hypotension, treatment may include lifestyle changes, medication adjustments, or, in more severe cases, medical intervention. In any case, if dizziness is recurrent or has intensified over time, do not wait to seek medical help. Early detection of health problems is always the best way to prevent serious complications. Your doctor can help you identify the cause and recommend appropriate treatment. Seeking medical attention at the first sign of dizziness or other associated symptoms can save your life. Remember, health is something you should always prioritize. Do not ignore warning signs, because with proper treatment, most conditions that cause dizziness can be successfully managed. Now that we understand the most common causes of dizziness upon standing and how to deal with them, it is important to remember that this symptom, although common, should not be ignored. If you're frequently experiencing dizziness or other associated symptoms, such as shortness of breath, chest pain, or fainting, it is essential to seek medical help to investigate the underlying cause. The sooner you seek treatment, the better your chances of avoiding serious complications. Fortunately, there are many ways to prevent dizziness upon standing. Staying well hydrated, adopting a balanced diet, exercising regularly, and reducing stress are simple but effective steps to improve your cardiovascular health and ensure you feel good throughout the day. Remember, dizziness upon standing can be a warning sign from your body. Ignoring these signals can result in more serious problems in the future. But with the right care, you can not only prevent dizziness but also improve your quality of life and ensure your heart and body function at their best. Seeking medical help and following a healthy lifestyle are key to ensuring a longer, healthier, and dizziness-free life. Don't wait until the problem worsens. Take care of your body today to live healthily tomorrow. If you enjoyed this video, share it with friends and family who may benefit from these tips. And remember, your health is the most precious thing you have. Take care of it.